Good evening, everyone, and welcome to the 1923rd uninterrupted webinar day of IFPH. I am Arya, and I'm a third year student from Adirashramam NSS Homeopathic Medical College, Kottayam. And today we have with us Dr. Amit Mittal. He is the founder, CEO of the Swastham and the co-founder of Glamritz Institute of Cosmetology and Aesthetics, and he also was an ex-consultant of the Indian Air Force, and he has numerous recognitions, including the Times Travel Award.
Hello.
And today he will be presenting before us a very relevant topic: the diseases of the soul, exploring karma, emotions, and homeopathic cures. We welcome you, sir. The dice is all yours.
Please unmute, sir. Please unmute.
Am I audible to everybody now?
Yes, yes.
Fair enough. First of all, good evening, everyone. It's a great honor to speak today with you all guys and listening across the globe. First of all, I want to congratulate IFPH team of uninterrupted more than 1900 days of this webinar. And I will be discussing about something which I learned in almost 25 years of my practice. The connection between the soul, the karma, the emotions, and the homeopathic cures. The human beings suffer not only physically but emotionally and spiritually as well. The disease begins when there is an inner harmony break, and we as a homeopath have a power to treat the person as a whole. I talk of the body, the mind, the emotions, the life history, and also the inherited patterns, which I understand in my practice that it is not only the infections or pathology which create the disease. Many a times it is the resentment, the fear, the guilt, the humiliation, the grief that manifests through disease. And keeping in mind all those things, I'll be trying to explain something which I learned from my past. Are you all able to see my screen, guys?
Yes, visible. Everything fine.
Fair enough. So, my topic today will be exploring karma, emotions, and homeopathic cure. Normally, if I just talk as an Indian culture, we have few Ved, the Atharved, the Samved, the Rig Ved, and the Yajurved. And if you particularly talk of Atharved, it always talks about the health. And there is a beautiful shlok which we call it as Shanti Mantra. Om Sarve Bhavantu Sukhina. May all be happy. Sarve Santu Niramaha. May all be free from the illness. Sarve Bhadrani Pashyantu. May all see what is auspicious and good. Ma Kashit Dukh Bhag Bhaved. May no one suffer or be a victim of sorrow. Om Shanti Shanti Shanti. I always start my day with this Shanti mantra because on a daily basis we are having a combat with the disease, with something which is not normal in life. A person who is unhealthy, what we say now, a person will connect us only if he is unhealthy. And this unhealthy comes from our soul cry. And what I found and what you all know, that we are not the bodies that have a soul, but we are the souls which are temporarily living in the body. So we all know that we have generation and generation, our body brings up some soul. So what in our homeopathy we call as that whole body's whole life is made up of three things: the body, mind, and vital force. And that vital force is nothing but soul. It changes up. So basically, disease are often messages from soul when they are crying for correction, purification, and further growth. That's why the name disease, dis-ease, away from ease. So the whole theory which comes to my mind was a couple of years back when I was just going through few patients, some patient. I remember in the year about 213 or 14, There's a girl who was suffering from chronic bronchitis and disease and dyspnea. It was not asthma, neither COPD, but it was chronic bronchitis and more or less allergic bronchitis. We tried our level best, but I was unable to get the good results. One fine day, that girl comes to me with her parents. The girl's age was about 23, 24 years that time. And when they were sitting with me in my clinic, they put some papers on the table. And through my just surprising, I found there is a booklet which was the Kundali, the Janam Kundali, the horoscope of that girl. With the curiosity, I asked, what was it? What is it? Her father replied, Doctor, sir, the marriage of his daughter has been fixed now. And we had just came from the priest and he says just about the marriage and all those things. I'm like, is all thing okay? So he replies that the doctor says that the priest says, the Pandit, the Pujari, that there is some lacuna in her kundli and where the Chandra, that moon is heavy. And the person who have the heavier moon in their horoscope, by default, they have the breathing troubles. So that girl was having. From there, it clicks to my mind. There is something which is linked with the horoscope, with the past instances, the current, the future. And if I be able to inculcate those past instances or the horoscope, what says as a moon heavy, will it be good to go or not? Then the second question I asked from her father was, what that priest or the pujari advised to you? They said that if we make my daughter wear a silver pendant with a pearl inside, that will make her moon lighter and she'll be getting rid of all those kind of what you say, the breathing discomforts. That makes me think, how suppose that priest advises her to wear the silver. If I make her eat the silver of our pathy, let me see what happened. So I prescribed Argentum Metallicum 1000, 3 doses, and rest the Saclac was given. And I asked them to come again after 15 days. And believe you me, guys, to my great astonishment, I found after 15 days that girl was almost 80 to 90% recovered. When she was got married, now she's a happily married and great mother of 2 kids and no more symptoms. So that kicks to my mind, if I just work something for my past, something for my of my what the past are. So there comes from my mind that there is something which I could deep dive into. And from there the things arises, the karma and disease, what our Indian understanding says. So, guys, I started my talk today with my Vedas, with my Indian culture. We have Atharved, Samved, Rigved, Yajurved. In Atharved, which talks of always health, prosperity, there's a beautiful shlok, what you call as a mantra or a phrase, that Ojas Tejo Mahi Dehi, Ojas Yojo Mahi Dehi. And that's nothing but the soul of mine is praying to God, the divine power, that you are the embodiment of the infinite energy and power. Fill me with that power and energy. So that slok says that we as a human being, which is we are having a soul inside us, that soul is nothing but just a micro part of the divine power. And the divine power is having the infinite energy. If I be able to get that little amount of energy, I'll be in the state of prosperity. Just for example, to say, many a times it happen when we are going on a road and we found some beggar coming to us and asking for some help or food. We just open our wallet and found a 500 rupees note, and we don't help him. And later on at home, we used to say that and today, now I was just my soul was cursing me. I was unable to help that particular little chap. But it means it's my thought process who doesn't want to help that child, and not my soul, not my vital force. That makes my soul unhappy. Right. So it has been clearly stated and mentioned that to every karma, we have a consequence. And those unresolved karmas, they manifest as physical, emotional, or mental suffering. So we have to find and deep dive into the system to understand what the karmas are, what the past karmas are. The karmas are nothing but the day to day proceedings of our life, the past of our life, the mental sufferings, the emotional problems, or the trauma what we face. And if you just find in your patient, which I also find out when I was going through multiple patients and everything, that where's my screen gone? Just a moment, guys. Screen has gone. That if a person is having a liver disorders, if we just deep dive into it, we will find there is a huge history of anger, continued anger. That anger, persistent anger or irritability makes him suffer from the liver disorder. Simultaneously, a person having a strong fear of anything, maybe dark, maybe height, maybe blood, knife, God, soul, ghost, anything, those people are suffering from kidney dysfunctions. Simultaneously, a person who's having a great greed and attachment to anything that causes metabolic disorders, metabolic disease. So by default, what I understand from my past and what my lecture is going to be depicting today will be that disease is often a visible expression of invisible karmic and emotional wounds. So जैसा कि what we used to study in our medical colleges, when the body, the mind, and the vital force are working in harmony, that is health. And if any one of has been deranged, that is called disease. So that is nothing but the expression of invisible karmic and emotional wound. So just example, if there are multiple people who are playing some band, one with guitar, other with flute, and they are just randomly playing, it will be just a kind of a noise to my ear. And if they are synchronized, that is a condition of health. So this is same occurs with our body as well. So guys, you all know about this karma theories and nothing as such to say that you will not understand. The first is there is actions in life, that actions taken in present. Whatever we do today, it have a consequences in the future. From current action, those consequences arise. And from those consequences, the future lives are impacted. If I am a chronic alcoholic from past, then definitely my present will be deprived from many of the healthy condition. And those consequences further create some circumstances that future lives are affected by that first karma, that first action we taken. And those circumstances, they create emotional patterns. So emotional patterns are formed. And this emotional patterns of say dullness, drowsiness, or irritability, anger, and depression, multiple thoughts, they lead to physical health, and the physical health is affected, which is known as physical illnesses occurred. So this is the whole cycle of karma. Do something today and get the results in future. We used to study in our college. If we study regularly, we'll get good marks. If we don't study at the end, we have a depression. We have a stressful life to complete our lectures and complete our exams even. So guys, this slide simply says that the disease as a doctor, what we are looking currently, is just like an iceberg phenomenon. We are looking just a small part of the condition of that human being as a life. Deep down, we have emotional tendencies, physical vulnerabilities, unresolved karmic imprints, and past events. Definitely, if we talk of genetic disorders also, that comes also under unresolved karmic imprints. So, looking at one picture of disease and prescribing is part of different pathies like the modern sciences we call allopathy. Say antifungal, antibacterial, antiviral, antipyretic, anti-pain, analgesic, anti-vomiting, multiple things. But we as a doctor of homeopath always deep dive into the system and try to have the RCA, the root cause analysis of the particular disease, which may give us a clear picture of the patient, what kind of problem is he suffering from. So when we look about the emotions and the body, they always have a scientific connection. And currently also, if I talk of psychosomatic, the modern sciences, they also agreed that emotions create disease. I think this is the only reason why today the psychopaths, the psychologists, the psychiatrists, they are evolving up. Therapies, the sessions, they are been giving up. And I'm sure that homeopathy recognizes this through miasm, syphilitic, psychotic, soric, which can also be seen as energetic imprints of unresolved inner conflicts. A small example to quote there is about 3 years back, there is a patient, is a chief manager with Punjab National Bank here in my city, Ghaziabad, but just near to my clinic and where I'm running a institute also for cosmetology. His age was 42, is 42, not was, his age is 42. And that manager, he was suffering from chronic acidity. On taking the history, I discovered that he was suffering from this particular acidity since last about 20-25 years, and he's almost on antacids once or twice a day even. Otherwise, his day becomes hell. I went to the file, the past treatment he had taken from different gastro, MD medicine, internal medicine, and multiple people. So his blood reports were perfect. The ultrasound was perfect. Eventually, CCT abdomen was also done, and that was also perfect. So no pathology was there, no radiological findings were there, but still he's suffering from acidity and hyperacidity. I start asking the symptoms, his current situation, the past situation, family history, but didn't get something solid to prescribe him. And further discussion going on. Then when I went and tried to deep down into the childhood of that particular boy, he shared with me that when he was 11 years old or 11 or 12 years old in the class 7th or 8th, he was good at studies and they are living somewhere in a rural area in the eastern belt of the country. So their parents shifted him and got him admitted to a hostel in the city, which was a little bit bigger school and college for the further studies for his future. And he was very happy because he wanted to study. So he has been shifted from home or changed his place from home to the hostel at the age of 10 or 11, whatever it. And continued from that particular age since last 33 years, he's not living with the family. So family means once or twice a year, maybe the winter breaks or the summer breaks, or some event like any Pongal, Diwali, Dashera, Holi, which has been celebrated in the North India. So that makes him apart or depart or deprived from the love of the family and the childhood friends. So that emotional trauma, which he was accepting as good for the future, was embarked in his mind, and that was a suppressed emotion. And on this base, I prescribed him natramuraticum and simultaneously also requested him that you should go instantly to your home, take some day off from the office, live your childhood life there with your parents, with your siblings, your old childhood friends. Stay there for 5, 6, 7 days, whichever is permissible to you from your job, and then let me know after 15 days. And I just parceled him medicine for 15 days. And guys, when he came after 2 weeks, he directly came to my clinic in the evening at about 8:30 or 9. He drove down right from the east of Kanpur. Sir, from last 12 days, I have not taken a single tablet of antibiotic. Oh, antacid. So this is the power of working on the emotional suppressions. That is the power of solving the past griefs. So if I talk of emotions, the grief, the possible physical reactions are asthma and depression. And remedies which I found were ignitia and natramuraticum. So I'm not going into the depth of when to prescribe ignitia and when to prescribe natramute. That will be also your capability and capacities and your understanding of the patient and the symptoms. So you guys can very well understand what patient comes to me and what is narrating and what should I prescribe. But having said, this is something which I found in multiple patients when the patient is having grief, is suffering from asthma or depression, and simultaneously, if depending upon the history and the past, if I prescribe him magnesia or natrium, he got relief. Similarly, if he's having a high level of anger, hamesha gussa, always shouting, shouting, and shouting, in that scenario, he likely to have chances of hypertension and liver disorders, where a nux vomica and staphylococcus helps him a lot. When he's having a history of fear, many people comes to you and says that I cannot go on the terrace in the night. Fear of dark, fear of ghost, fear of sharp knives, right? Fear of height, fear of water, fear of drowning, fear of death, multiple things. Those people have panic attacks, and they can also have urinary disorders. And when these patients have been given aconitum or argentum nitrate, or whatever the symptom may be, they got a wonderful results. So the whole idea of telling you this point is that the right remedy not only removes the symptom, but it releases the trapped emotions. And guys, if I just go to the next slide, you will see that the homeopathy is a tool for emotional and karmic purification. The medicine, what we call as potentized medicine, they act on the energetic planes, the same plane where our karma and emotions reside. We talk of the body, mind, and vital force. So, what that vital force is? Whenever this vital force is being deranged, our body or our mind comes into picture. So in past, there might be some emotional trauma, some karmic trauma that deranged my vital force, and in today's scenario, it makes me disease. So when the remedies are being selected, they are always been selected on totality of mental, emotional, and physical symptom. So we always go for a case record, the case taking, and case taking comes up in a serial pattern. Number one, we go for current symptomology, what current symptoms he's suffering from, what signs and symptoms he's having. Then we go for the past histories, what is having, with any past disease. Then we go the mental symptom, the mental general, the mental physical and the mental particular. We go for the physical general, physical particular. We go with the desires and aversion. We go with the chilliness and hotness. We go for family history, and then we go the mental symptom, the emotional aspect, the attributes of the patient, and that totality helps us in bringing unresolved emotions to the surface. So that person, when I prescribed the manager of PNB, I prescribed him Natrum Muriaticum and requested him to go to the native rural place and stay there for. That creates the emotional catharsis. You can find after giving that medicine, either the crying of the patient increase, irritability can increase. So basically, he's trying to release the suppressed feeling. And this release comes up when we have a well-selected remedy. And it's restored the complete inner balance. Basically, all the three parts of life, the body, mind, and the vital force, they come into balance. And what is Atharved we called as Satguna dominance. So when this healing comes up from inside, the patient does not heal physically, but also spiritually. They become more peaceful, they become more resilient and connected to their higher self. So what we call as self-actualization. We need something, we need something, we need something, and finally the self-actualization. So when we come to that particular level with our medication, that's called a proper healing. And this is not what I'm saying. If you just go to these books, if you all want, you can take the screenshot. When we go with the Julian's Materia Medica of Nozodes and Shankaran's mental themes in Soul of Remedies, if a person is having a karmic guilt, the destruction, syphilinum works a lot. There are many person came ke, Dr. Saab, in class 12th, I was unable to clear my boards because I was busy in, say, playing cricket or in some tournaments. And because of that, my 1 year was lost. And I was behind my family, I was behind my friends. They have attained a good position. So there is a karmic guilt. What he had done there around 20, 25 years back, what that PNB bank manager did almost 33 years back, leaving the family, leaving the friends, leaving the village, and going to the city for his future perspective for profession, that's the karmic guilt. If given syphilinum, as per Shankaran and Julius Materia Medica, he will get relief. So I didn't prescribe syphilinum because I prescribed Netremuru. Many other symptoms are also of Netremuru. Simultaneously, the childhood trauma. There are people like perfectionism. They want everything perfectionist. Inherited patterns. The soul of remedies of Sankaran and the carcinosin picture by Roman Murphy says carcinosin is the indicated remedy. There might be a possibility of ancestral grief, where emotional walks. The Kent Materia Medica and Shankaran says Netremur can be given. Right. So this was a symptom because of which I prescribed that manager the Netrem muraticum, the emotional walls. The emotional walls means he was away from the house, and in those times there were no mobile phones, there were no SMS. There was one landline which was placed in the common room of the hostel, and the parents used to call, and again they call, and the student should be there. So that was a wall which was created in his life between himself and the close one with whom he stayed till the age of 12. Simultaneously, if I talk of karmic theme of suppressed femininity, the burden, the homeopathic psychology by Bellis and Shankaran says sepia, karmic theme of suppressed femininity. Or a wonderful example to quote. About 8 or 9 years back, a lady of age 29 came to me. She was married and no kids. The only reason, till the age of 29, she had never menstruated. Never menstruated. It was shocking for me as a doctor, 29 age and never menstruate. I start deep diving into the system, deep diving into the patient, get the past history, the current history, the family history, blah, blah, blah. Nothing was been found where I could link that amenorrhea till date. Why? I requested her to call the mother and the father. Father didn't turn up. After 4 or 5 days, her mother came. When discussing with the mother about her childhood, after some time, I got to know that this girl was the third child of that couple. And before that girl, they were having two more girls. As a matter of fact, for those time, and that desire and love to have a boy to continue my throne, those people went for the ultrasound for sex determination, and when they found that the third time there is a girl in the womb, the family pressurized her to abort. But that lady was strong headed, she refused. There was a high level of quarrel, traumas, fights, and finally she had to leave the in law's home and came to her parents' house. Thereafter, she delivered that third girl child. But in due course of time, things become better, better, and better, and they were again back to her place. So there was something suppression of femininity during that womb when the girl was pregnant. By my past experience of karmic healing, I have found that this girl has been suppressed for her femininity because her mother was forced to abort her. That brings her uterus, her vital force, especially her vital force, to forcefully stop the uterus to function as a female. Means that soul, the vital force, doesn't want that lady to be mother again of one more girl child. That is suppressed femininity. In that case, I prescribed her sepia. The family comes back to me about 10 or 12 days, and she menstruated for the first time. And finally, they have one child, and happily family. So these are some examples which I found in real time of my life. The ego detachment, the spiritual awakening, the Materia Medica Pura, Shankaran's description of sulfur spiritual conflict. The sulfur is the remedy. Fear-based karmic cycle. See, I am a strong believer and strong regular study of Shankarans and Kent. So in every time I read Shankaran or Kent, I found something new. So this is a recent, I found that fear-based karmic cycles. Calcarea karma is a wonderful remedy. Acute grief, acute and emotional purging. The Kent's lecture and the soul themes by Grant George says ignitia. So one thing to be added on there is, if there's an acute grief, we go towards ignitia. If there is chronic grief, we again go towards the natramure. Karmic nosode, carcinosin, madorinum, syphilinum. So Julian says that nosode study, man. Karmic nosode is nothing but carcinosin and madorinum. So guys, just to say that the disease or the suffering is not something where my soul or my vital force is being punished. But frankly, it's a spiritual teacher. And this understanding comes only to we as a homeopath. By the suffering, we learn patience, we learn forgiveness, we learn letting go for attachments and surrender to the divine will. जो मैंने second slide में कहा वो जो मही देही, that is the crux of the whole disease symptom of homeopathy. And we are just trying to, and not trying, we are healing by gentle removal of those energetic blocks and accelerating the soul evaluation. So overall, the only thing which we require is to deep down into the patient's life history, in patient's past history. Thereby, the true cure will not be only disappearance of symptom, but blossoming of the soul. And when all these things come into harmony, again, we'll help in the health. At this point, would like to narrate one more case. You will love to hear that. This is something which is very close to my heart. In 22 September or October, I think September, October, there's a family who were basically settled in USA, right? And the guy was a software engineer, and due some attritions and cost cutting, he has been fired from a job layoff. He was been laid off. And after discussing with family and everything, they came back to India, right? And after coming back to India, he searched for some job, but definitely the job which was there in US, especially the CTC, the cost to company, the salary package, was not been offered in India. He was almost vacant for 2 to 3 months. Then he planned to start his own software company, which he was having some mind in from very past. So he, along with his wife and one of his friends, they started a company. And when they're in the pipeline of starting the company, that patient suddenly suffered from bilateral foot drop. The problem comes. Why? He is a healthy person. Although he was having diabetes, but it was a controlled diabetes and he was just only on metformin. And since from last about 5 or 7 years. So when I started discussing with him, before that he went to multiple doctors like MD medicine. He also been to neurosurgeon. He has been to neurophysician as well. So somebody called him that he's suffering from some back problem. Somebody says okay, he's having a chronic cervical spondylitis. That's why he have a foot drop. Somebody say that he's suffering from GB syndrome, the Guillain-Barré syndrome. But he was not accepting all those facts because he was having back pain, that nothing as such in the back. Spondylitis never. Then from a known among we two, the common friend, he came to me. When I start discussing his symptoms, the past life of the US, before marriage, after marriage, then the shifting from US to India, and then starting the own company, investing much of the amount he bring from US. The major thing which I found in him was, the rubric was fear of financial loss. I think many of us and you guys have heard about this symptom. If you go with a synthetic repertory of Barthel and find some fear of financial loss, the single remedy is Kali Brome. I prescribed Kali Brome, and then then was given Ignitia, then Kali Phos. These three medicines are repeated with an interval of 1.5 months, depending upon their follow-up treatments and all those 12 Kent lectures. You know. He was cured in 2 months. And today he started his company and doing good. The basic thing I want to say is that as a doctor of homeopathy, it is much required for us to integrate these points in our daily practice. My teacher in my college times, Dr. Jaiswal was there. He's a wonderful philosopher. He used to say all these points, not every, but few. Number one, he says that we should be always a silent listener. We should be a keen observer. We should never interrupt the patient to narrate the stories. Let he be the storyteller. Let he deep down into his own life, his family life, his social life, his personal life, his financial life, his professional life. Because many a times when he's talking freely, and once he comes into comfort zone by the talking to we as a doctor, he or she can narrate what is exactly inside her belief, what is exactly inside her thought process. And that makes us to understand the exact rubric. So we should explore the emotional landscape and key life events with compassion and care. A silent listener, a keen observer. We should understand the life patterns of grief, betrayal, fear, guilt, happiness, excitement, blah blah, many things. When we are selecting the remedy, that should not fit only the physical symptom, but should match the exact inner stories of the past. And when this matching is done, we find a wonderful thing. We should encourage the patient to embrace emotional release as a part of healing. As I said, just make him free flow with the talk. Bring him in comfort. Yes, don't worry, I'm here to listen. If you talk with the patient with very much caring, compassionate, and unlike someone is hearing you, but one thing to be keep in mind very clearly, that the patient should have an understanding that everything which has been spoken by me in front of my doctor is going in a black hole. It will not repercuss in some other way with my family members or friends. So what you called as a data, the privacy, number one. Inspire them towards the spiritual practice, prayer, forgiveness, gratitude. Means once we are prescribing the remedies, and if we found some past patterns, we as a doctor, as a homeopathic doctor, should also advise him the theory of forgiveness. We have a well saying here in one of our shlok in Gita, Jo hua so hua. Means anything which has been done in the past had been done. We cannot revert the time. We had done our karmas. We have done everything what we have done in the past. We cannot change that past. We cannot accept the future. We cannot access the future. We cannot uh, go in the future. But we have to live into present. And living into present will always be happy when we forget and forgive our past and do not be in the curious state of mind to what is going to happen tomorrow. That will bring me in a very state of comfortability and confidence. So, in my last one or two lectures before, somebody asked me what you mean by karmic suppressions, the karmas of the past. So, as I said, when we allow a patient to talk freely, when we allow the patient to speak, and we are listening and understanding him in a very compassionate and caring manner, when he's talking to us, he will state some symptoms. Say example, why me? This happens always to me. The patient says, Dr. Saab, I can't understand why it happens only to me. I'm giving the best. My many ladies come to me. I'm giving the best to my family. I'm giving best to my husband. He used to wake up in the morning 6 and sleeps in the night 12. Doing best possible what I can do, but still me. It happens to me only. Means the possible karmic rule is victim or injustice has been done to her. And this victim and injustice will help us in finding the real rubric. I just can't let go. Right? Means a case, a fight with a friend, right? And he's saying, sorry, yaar, I'm extremely sorry, bhai. Extremely sorry, boss, my dear friend. I did wrong, but no, I'll not let you go. That ego is there. No, I'll not forgive him. That means there's the attachment. or the controlling power. I'm so much attached with the person, the expectations are so high that could not accept in my mind that he can do with this to me. That attachment will help us to understand the karmic clues. I have been betrayed so many times. A kind of a first statement, this happens to always to me, but I have been betrayed so many times. This is part of my life here. What I can say? Uh, the people in my life comes to me just because they want something from me, and as soon as their work has been done, it's in place, they betray me and lose me. This is betrayal, the trust wound, the issues. No one ever listens to me. The child says, the lady says, sometimes the husband says, whatever I want to say in my family, whatever I want to say in my office, my boss, my colleagues never listen to me. That is suppression of his feelings. Unacknowledged self. So these people, when they have been unacknowledged by self or they have suppression, they always will try to prove themselves. Whatever I'm doing, it's the best part. I must keep everyone happy. These are pleasing, self-neglecting. So they will prove you that no, I'm doing something for you. And they'll not say it, but they will try to prove every time they'll try to best. I feel like I'm being wrong somewhere. I don't know. I think I'm at wrong place. I think I've not done something good. That's why I'm here. There is a past life suffering. There is a guilt. So these statements, we have to listen very carefully and understand what can be the karmic clues. Because these clues will help us to understand the things. Now, how the homeopathy heals the karmas. As I said just a few slides back, that we are working on vital force, right? So we as a homeopath, we are addressing the constitutional layer. Every person have a constitutional remedy that you knows, which matches their core pattern. This often includes karmic themes like repression, staphylococcus, first grade remedy, self-worth, lycopodium, sacrifice, casticum, right? By unlocking the vital force, remedies act as a level of vital force, allowing unconscious blocks, traumas, and karmic imprint to surface and release. As I told previously as well, when a well indicated remedy, depending upon the totality of symptom, the mental, the physical, the constitutional layer, when we are hitting the constitutional layer of the disease pattern, many of the catharsis appears, right? So that unconscious blockage in the mind may burst up into tears, they burst up into laughter, they burst up into any kind of a discharges from the body, maybe passing of multiple time urine or the stool or the over sweating. But that unblocking of the traumas and the karmic imprints and coming on the surface to release will bring him in the position of health through awareness and transformation. When a well matched remedy, the patient experiences insights, he can experience dreams or emotional clarity. Many times it happens when we prescribe some medicine, so we are not getting an exact picture of the patient. Thereafter, they give say Nux vomica or Teucrium or say just a Lycopodium or Staphylococcus. But once he came again after 7-10 days or whenever we bring him follow up, all the emotional clarities come up. That suppression due to multiple drug pictures, multiple allopathic medicine, which have suppressed the thought, which have suppressed the disease condition, which have suppressed the mental symptoms, after giving our homeopathic remedies, they burst up. And thereof come the emotional clarity. So what I expect or what I felt and what I experienced in my past is that, first of all, let that real drug picture comes up. To give the time to the patient by giving some antipsychotic remedy. That will indicate us the release of karmic pattern. The conclusion for my lecture is that we as a homeopath are blessed to touch the soul of suffering of humanity. We are the instruments for restoring not just health, but harmony of body, mind, or spirit, what you call as vital force. Wherever the science ends, the healing begins. Where the healing blossoms, the soul shines. And this is all the crux of my today's lecture. If you guys are looking for health, if you guys are looking for a treatment part, and especially in the chronic cases, right? In a say example, a person is coming to you with infertility. If you see a person is coming from chronic bronchitis, or you are suffering from eventually diabetes as well. So diabetes means that the body is unable to digest the sugar and there is no insulin production, and finally the sugar levels are increasing, right? So something there might be in past. He might get an extra of betrayal. He might get an extra of bitterness in the life. That bitterness has caused insulin should not be created and further diabetes. So as a spiritual healer, as a homeopathic physician, we must be very much clear in understanding that the disease is nothing but a cry of vital force. So it is a manifestation of the calming imprints of vital force, which comes up in the form of symptoms and signs. And I think this is all from my side. This is my institute, nothing else. That's it, sir. Dr. Dinesh.
Yes, you can go ahead.
Thank you, sir. Is there anyone who would like to ask any questions or interact with Dr. Amit? Please raise your hand so that we can come to you.
Yes, Dr. Amit Mittal is really a vast presentation with powerful presentation. That's what I can conclude. Just you have to prove a point here, and what is karma and how karma works and how it results and how we get the results out of it. And the cases shown are here are two, though the both cases were really excellent, and the result of the case is also exactly what that was expected. And only homeopathy can do such wonders in that
Only,
way.
yes, fair enough.
And
Only homeopathy can do.
uh,
Not no one else. No one can else can.
our homeopathy, even though Dr. Hanuman has never visited in our India, but there is some similarities here, and that's the reason why we got such proving also that you are able to connect both of them together. And as Dr. Shankaran used to say that this karma is something different and how karma and homeopathy is connected. And you are the
Yes,
right person who explained it in a beautiful way.
I
And
tried my best. I tried it. I tried it.
exactly, that's what, what's your experience in other simple cases also? Or how will you manage acute cases in this way or in a different way? What is your role?
Yeah, sure. So having said that, if I just talk of acute cases, right? There are the past karmas does not have any place, which I have found, because acute cases are just the manifestation of current life. I went to a marriage function last night, had an outside meal, lots of kachoris, lots of oily food. My stomach got disturbed. So there are, I always try to go with the therapeutics. A reason being, sir, when a patient is coming to me, he is coming with some expectation and hope, right? So just suffering from sneezing and running nose or a diarrhea or dysentery, if I start having a case record of half an hour, 1 hour, thank you, sir, it's done, I'm going. Right. So being into professional also, being into practice also, being into a healer also, in every case we cannot deep dive into the karmas. But the second scenario, how suppose that patient is suffering from recurrent rhinitis, right? And if it says, sir, I'm having a sneezing, does it happen before as well? Yeah, I'm suffering since my class 10th, almost 25, 27 years. And whenever there is a change of weather or change of temperature, I'm staying in my room with the AC on, comes outside or come inside. So that is a chronicity of allergic rhinitis which is coming up in the picture. Then I have to deep dive into the system. So every case to bring into karma, I think that will be a kind of a prejudiceness for me. It all, what I'm saying is, when we talk of the cycle of karma, anything we do today have the impact in future, right? You guys have started these lectures or these webinars since very long, 1923. So that impact says today how many followers we have. I recently joined you guys about a month or so before, but it gives me a pleasure that I am in the right place. At least people are understanding what homeopathy is. But believe you me, Dr. Danesh, I think when we all work together and touch that sky of limit, that in this forum, when currently we are having only 20 participants, and I think all are doctors. When there is a ratio of 1:1 of doctors and non-medicos, I think our work will be accomplished. Right. So that awareness will be into the common people. What I found, they used to go to the allopathic doctor, the Ayurvedic doctor, the blah blah, and our case is totally ruined. Then as a last resort, they come to us, to a homeopathic doctor. This I found here in North. I remember a case about 4 or 7 months before, 5 or 7 months before. That was the case of psoriasis. Right. Eventually, I can show you the picture of psoriasis as well if you want to see. Just a moment. Let me show you the. See, can you see my screen?
Yes, it's visible.
So this is the case of psoriasis which come to me on 16th of July 2024. You can see the date here. Right. And this is the condition of second leg. Okay. So, and he was having a thick file of about 200 or 300 pages, suffering to last about 17 years. So after having a discussion, I simply asked, so have you taken any medicine of homeopathy? He says, no, sir, this is the first time I'm coming to homeopathy. In 17 years of his treatment. But why didn't you went to a homeopathy doctor? Oh, sir, it's a long treatment. Nah, we have to wait for long. Fair enough. I prescribed some medicine. He came after 15 days, and the 15, normally I used to give the medicine 15 days first time. That's why multiple time I say 15 days. His itching was reduced to 70%. Right? Dryness have reduced to 30-40%. The first question he asked after coming to me in the follow-up visit, Doctor Saab, how much time I have to take the medicines? Right? I simply answer, sir, I think almost about 30 to 34 years. Well, what do you mean to say 30 years? Sir, you have taken the treatment of allopathy since last 17 years. You came to me as a homeopath for the first time with the saying that I didn't went to homeopathy because it's a very long treatment. So long means at least twice the time of allopathy, la. Then he says nothing, and God grace, he's very good now. Almost 1.5 years passed, very good now. Anybody else want to ask anything?
Yes, Dr. Sarbi from Canada.
Good evening.
Yes.
Hi, good evening, Sivgi. And thank you for the wonderful comment, Sivgi.
Sorry?
Thank you for the wonderful comment you posted in the chat box.
Thank you. Very interesting approach. And I believe that Heinemann said like you, there is not the disease in vital force or soul, but the imbalance of the energetic levels. And you will see, you show ice like iceberg, like iceberg, karma in the deeper level, and in the daily currently the psychological and subconscious and conscious, and resemble that. And it's very wonderful explanation. And we don't know karma in Anatolia. And I am a Turkish woman. I'm from Turkey, and there is a good explanation for karma in Anatolian language. If did something grandfathers, and we explained that in 7 level later, grandson, some imprint. It's like a karma, resemble the karma explanation. Thank you so much. And we that in the DNA or daily currently medical explanation that the changing the or differentiation the DNA. Thank you so much. It's
Most
very
welcome, most
interesting.
welcome, most welcome, most welcome, guys.
Yeah.
Dr. Ramparesa, sir.
Dr. Ram, sir, good evening.
Thank you. Good evening. Thank you, Dhaneji, and congratulations. Heartiest congratulations, Dr. Amit ji.
Thank you, sir. Thank you. Again, talking to you just in a span of 1 week.
Your wonderful and inspiring
Thank you.
IFPH presentation
Thank you, sir.
on disease of soul behind the so truly enlightening
Thank you, sir.
disease of the soul. But soul suppression of anger, suppression of fear, suppression of grief, यानी बुद्धा theory, fear, delirium and anxiety.
Right.
Fear, delirium and anxiety is a कर्मा, और कर्मा ही जो है बहुत बड़ी बीमारी है, कर्म से ही होता है. हमारी सुभावना है हिंदी में.
Right.
हिंदी में सुभावना है. आप तो हिंदी भी समझते हैं, हिंदी में दिए हैं प्रेजेंटेशन.
Right.
हम हैं अमर निरोग हैं, सर्वशक्तिमान है, सुंदर जुवा बलवान है, धनवान है भगवान.
Beautiful. Just to add on.
अब ज्ञान अपना हो गया, हम डॉक्टर बन गए. अब ज्ञान अपना हो गया, बस रोग दुख सब दूर है. हम रूप यौवन युक्त है, आनंद से भरपूर है.
बहुत सुंदर. Beautiful.
आनंद से हम है उछलते, रोग हम में है नहीं. आनंद से हम है उछलते, रोग हम में है नहीं. हम है अमर, हम है युवा, धन धान सब कुछ है.
Beautiful.
तो बहुत वेरी नाइस प्रेजेंटेशन. घर घर होम्योपैथी, हर घर होम्योपैथिक. वेरी थैंक्स.
Thank you, sir. Thank you. Thank you, sir. Thank you.
What you have to add?
Just to add, for my karma, we all are from science background, and if we just go through the Newton's 3 laws of motion, I think that's also explain our disease very well. Right? The third law: to every action there is equal and opposite reaction.
Exactly.
Right? Every object is continued to be in a state of rest of motion until it is stopped by some external force. Again, my medical science, my homeopathy.
Primary action, then secondary action.
Right, sir.
Yes.
Anything else, sir?
Yes, there's one announcement. Tomorrow we will have a session from Dr. Suzy Singh Bahodia, and Doctor will be talking about material science in homeopathy.
Oh, great.
He's always coming in with his research papers, and it is over to to Miss Arya to conclude the session with auto thanks.
Thank you, sir. First of all, I'd like to extend my thanks to Dr. Amit Mittal for a wonderful session and for spending time with us. And I would also like to thank all those who have participated in this webinar. And gentle reminder, if in case you have missed any videos, we will be uploading our daily webinars on the International Forum for Promoting Homeopathy YouTube channel. You can check it out there. Thank you again and have a good evening.
चलिए, थैंक यू
Thank you, sir.
डॉक्टर आर्या AR का जो मॉडरेट के लिए, फॉर मॉडरेट वेरी थैंक्स. चलो ठीक.
Okay, thank you all.
Thank you, sir.
Thank you. Okay, it's over to Dr. P. Shaila to moderate the Malayalam session.
Okay. Have a great, wonderful evening to everybody. Right.